patient presents with orchitis multifocal stenosing ulceration of the small intestine and parathyroiditis. What's your diagnosis?
It could be Crohn's disease with these symptoms.
I think it might be a case of Behçet's disease.
I'm leaning towards sarcoidosis as the potential diagnosis.
No, it's childhood granulomatous periorificial dermatitis. We need to perform ganglionectomy immediately.
But that's a risky procedure. Are you sure that's the right call?
Damn it, I'm the head doctor here and I know what I'm doing.
We proceed with the ganglionectomy. It's our only option.
Tracy, I need to talk to you about my patient with childhood granulomatous periorificial dermatitis. I believe a ganglionectomy is the best course of action.
Hawks, are you sure about this? That's a pretty invasive procedure for a patient so young.
Tracy, I've been a doctor for over 20 years. I know what I'm doing. Trust me, this is the right call.
I understand your experience, Hawks, but we have to consider all options before moving forward with such a drastic measure.
Don't question my judgment, Tracy. I know what's best for my patient. The ganglionectomy will solve the problem once and for all.
I'm not questioning your expertise, Hawks. I just want to make sure we exhaust all other options first. Let's discuss this further before making a final decision.
Fine, let's discuss it. But know that I will not back down on this. I have the patient's best interest at heart.
I can't believe this. The patient is in critical condition. How am I going to tell Hawks that the ganglionectomy was not the correct treatment for childhood granulomatous periorificial dermatitis? This is going to be a tough conversation.
What the hell were you thinking? You nearly killed our patient with your incompetence, wrong ganglionectomy, and wrong diagnosis.
I still stand by my diagnosis. It made the most sense given the symptoms presented.
I disagree. I think the issue lies in a different area altogether.
I believe we need to reconsider our approach entirely, looking at it from a different angle.
You all are a bunch of incompetent quacks. I can't believe I trusted you with this patient. Figure it out or you're all fired. Shock storms out of the room. I can't believe I still can't figure out what's wrong with the patient we saw this morning.
Come on, Hawks, you're usually the first one to crack a case. Maybe you're losing your touch.
It's very funny. Maybe it's just one of those cases that require more time to solve.
Or maybe you missed something obvious. Like, did you check their blood pressure?
Of course I did, Johnson. I'm thorough, you know that.
Okay. How about their diet? Could it have been something they ate?
That's actually a good point.
Wait a minute. I think I know what's wrong.
Already? That was quick. What is it?
I'll tell you later. I have to go check on something. See you later. Sorry for storming in without proper medical equipment, but we need to act fast.
You can't just barge in here like that, Hawks. It's not safe for the patient or us.
We need to prioritize safety and protocol, Hawks. This is not how we operate.
What's going on, Hawks? You're risking everything with this reckless behavior.
Trust me on this one.
Childhood granulomatous periorificial dermatitis wasn't the right diagnosis. It's benign hereditary chorea.
Tracy, I finally figured out the right diagnosis for the patient.
Congratulations, Hawks. That's great news.
If you had just listened to me from the start, this whole ordeal with the wrong diagnosis wouldn't have happened.
Hawks, the wrong diagnosis nearly cost the patient their life. You should have trusted my judgment.
Your judgment nearly killed them.
My judgment saved them from further harm.
This would have been avoided if you had just accepted my opinion.
Well, maybe next time you'll think twice before disregarding medical protocol.